So you're just muted.
I was just telling you he was leaning the wrong direction. Okay.
Yeah. Let's tilt down a little bit.
Yeah, this one.
Yeah.
Okay, great.
Yeah, that was great.
Go ahead.
Stacy, did any run of show changes here? Anything I should be aware of?
Not that, the only thing
Hello, everybody. Thank you for joining us. My name is Faiz Shakir. We're going to have an important conversation today about expanding home and community-based services. Before we get into that, let me introduce myself. I'm Faiz. I was honored to be campaign manager for Bernie Sanders this last cycle. I worked for Senate Majority Leader Harry Reid and Speaker Pelosi in prior lives, and I'm now the founder of a journalistic institution called More Perfect Union, which has been covering home and the fight for community and home-based services. So we are very invested in this one, and President Biden has done a wonderful thing in introducing a bold proposal that would significantly expand funding for Medicaid's home and community-based services. He's got two passionate and powerful congressional allies, and Senator Bob Casey and Congresswoman Debbie Dingell are going to be fighting in the House and in the Senate to make sure that his proposal is enacted. And so we're going to have a conversation about that in the next hour here. Setting that up, I was thinking about what I wanted to say about an issue that maybe some of you haven't had personal engagement with in your own lives. And many of you have, but some of you have not. But I think, in thinking about why I'm passionate about it, one of the reasons is that there's a larger fight going on here around what kind of economy we want to have. And if you think about the home and community-based services fight, it is ultimately about respecting a certain kind of economy that we all want to build for ourselves. And for too long, we have been told, that's a fundamental question of what kind of economy we want to have. Well, economic elites will tell you that we got to respect the NASDAQ and the Dow, and we have to look at metrics that include, the quarterly earnings of companies, and that's how we need to measure how our economy is doing. In fact, what we believe, many of us believe here on this conversation, is that some of the most important metrics involve how we treat one another in our daily lives. How are we lifting humans up? How are we taking care of one another? When you have hundreds of thousands of people sitting on waiting lists, waiting for home and community-based services, that's an important metric. That's the metric by which we could judge our economy. And once people come off of that waiting list, maybe that's a way to think about whether our economy is working for all or not. Another kind of element that's important to this debate is, how do we trust and respect labor? How do we respect jobs? What kind of jobs do we value in our society? And obviously, increasingly, Wall Street jobs and people like, the types of jobs that increase wealth. And obviously, there's been a lot of that going on in the pandemic. The wealthy have gotten a lot wealthier. But the types of jobs, as we learned in the pandemic, are the ones that we value most, are those workers who are on the front lines taking care of us and ensuring that we can live our best lives. And certainly, home care workers are doing that. Like teachers, like nurses, they are helping us improve our basic lives, live our best lives, improve and achieve the best that we can hope for. And I think, speaking for many, home care service workers out there we've spoken with, they, in addition to better wages, better benefits, we're also just looking for fundamental respect, to be seen, to be heard, to be understood, but the value that they are providing to society. And so I think underlying this fight for Medicaid funding for home and community-based services is really trying to retool an economy that truly works for all of us, and thinking about the jobs that really matter and thinking about the metrics that really matter. So that's a little bit about how I want to tee up this conversation. And I'd love to go first to Lynn. Lynn Widener has worked a number of jobs in her life until she landed in the arena of healthcare. Lynn, she's found her true passion in this healthcare arena. She currently provides care full-time for Brandon Kingsmore, who has spastic quadriplegia cerebral palsy. The two first met as adults when Brandon was receiving services at a facility that Lynn was working at. The services Lynn provides are paid for by Medicaid, of course. Lynn is paid roughly $12 an hour, poverty wages, $12 an hour for her work. Due to her low pay and lack of sufficient benefits, she has accumulated medical debt, foregone medical services that she otherwise would have gotten, and has been unable to take a vacation in years. Providing in-home care is a rewarding job for Lynn because she knows that it keeps people like Brandon out of a nursing home, allowing him to live in his own home, and makes his life possible and enjoyable. Lynn, thank you for being here. Please take it away.
Thank you so much. Thank you for having me here today. I appreciate the opportunity to speak with you. That's one thing that I'd like to say. First of all, I'm a caregiver. I'm a home care worker in Allentown in the Lehigh Valley in Pennsylvania. But I've been I've been a care worker since 2003. I got my CNA license at that point. And so I've worked in nursing homes and assisted living facilities and group homes. And I honestly landed in home care because the ability to provide one-on-one services, to be able to have people integrated into the community, to promote independence and inclusion is something that I'm really passionate about. I think that we're not far enough away from these terrible institutions where we locked away our disabled people and we kept them literally in cages. And we need to do better for our community, for the disabled, for the elderly, for the aging. And one of the ways that we do that is by providing home and community-based services so that these people can be included in our communities. And that's a passion for me. Unfortunately, the way that we value the care that we provide in this society is severely lacking. We do not respect caregivers the way that we should as a society. We have a system of home care right now that pre-pandemic was already struggling. So we have so many people that need services. We don't have enough home care workers in the field. We have, high turnover rates of staff, and it's really a struggle to work from day to day and running from client to client and knowing that you might be the only care that they have for that day and the only person that they see for that day. And you want to do the best that you can for them, but you have to work. At one point, I had 4 different clients. So I started at 6 a.m. and I went from house to house until I actually finished around 7:30, 8 o'clock at night. So working like that 6 days a week. And I still was living paycheck to paycheck. I was still having trouble paying for medical bills. And it's one of the real ironies of home care right now is that while we're doing all this, while we're providing all this care for people, there's nobody that's really looking out for us and taking care of us. So it's really hard for us to provide care to people when there's no care for us. So like my medical insurance right now is very expensive. The only reason I can even afford that is because I have 2 roommates. $12 an hour, that means I'm paycheck to paycheck. It's really difficult just to get the care that I need. And then my out-of-pocket costs have put me in $5,000 in debt in the last 6 months because I'm paycheck to paycheck. The pandemic has put a highlight on this issue. I've heard a lot of people saying that, we're essential and we're heroes, we're healthcare heroes. And what I want to say to that is, if we're so important, then invest in us, right? If we're heroes, treat us as such. Like, we cannot eat your praise and we can't pay our bills with your accolades. Like, we need real change in home care. And one of the things that I've worked in 2 different states. I've worked here in Pennsylvania. I've also worked in North Carolina as a home care worker. And I think that one of the big differences that I've seen is that in North Carolina, they don't yet have a union for home care workers. And here in Pennsylvania, we do have that. We have the ability to unionize. I'm a member of the United Home Care Workers of Pennsylvania, which is a part of the SCIU Healthcare Pennsylvania. And that really gives home care workers a voice. It gives me an opportunity to tell people my story, to lift up the fact that we're trying to care for people like Brandon here and like other people throughout the state. It gives us a chance to not feel so alone and to make real progress and real change. And I want that for every state. I want that for every care worker in the country. I want them to be respected the same, and have the ability to unionize. So that's one of the things that's really important to me. And I think that we can do that with this, with the plan that's coming out. We really need to invest in our home care. We have statistics like 30% of caregivers will actually end up dying before the person that they take care of. And one of the reasons for that is, we don't have the care that we need for ourselves, the stress of the job. We're more prone to having autoimmune diseases. Home care workers are disproportionately people of color. It's the system is set up poorly and it needs to change. And we really need to have some real reform and some real investment in our community so that we can build this care infrastructure, so that we can get people out and to work. We enable people to be able to work. We enable families to go to work so they don't have to stay home. So I really appreciate the opportunity to speak with you today and to give voice to these concerns that we have. I thank you so much.
Lynn, for your very thoughtful and passionate remarks there, and for allowing us to understand better the important work that you do, and so many people who do home care service work all across this country. Let me introduce Brandon Kingsmore. Brandon has had spastic quadriplegia since birth and requires significant assistance with most activities of daily living. He feels strongly that home care workers need to be paid better, provided better training, because they are providing essential services that people like him rely on to be done correctly. He also believes improving compensation can reduce worker turnover, as he has lost caregivers in the past because they couldn't afford to continue doing HCBS work. Brandon, thank you for joining us. The floor is yours.
Thank you. Thank you for having me on. My name is Brandon Kingsmore. I live in Allentown, PA. I've been getting home care since I was about 18. And throughout that time, I've had some wonderful aides. I've had some aides that had to leave the field because they were spending most of their money on gas just to get to my house. And when they got there, they would help me with things like bathing, clothing, getting me dressed. Without all them, I would not be able to live the life that I live. And it's really sad because, like my care worker said, they are more important to me than anybody else out there. I like to call them my angels because what do angels do? They watch over you, they protect you, they look out for your well-being. So this plan to me is more about, it's less about money, and it's more that I want my caregivers to get the same quality of life that everybody else gets. You know, I'm 32 years old, and I'm not the lightest guy in the world, but my caregiver, she had to lift me up and physically put me in the shower, and the job is hard. And every time I get in the shower, I have to worry, am I gonna fall? Am I gonna be dropped? Because they don't have the proper training that they need. I live in a 2-bedroom apartment right now because it's not accessible, and I have to wash my teeth at the dining room table. I have to use a bedside commode because I can't get my chair in the bathroom. I've had to go through a lot over the past couple of years, and now that we have this opportunity, we have to take advantage of it. Because if you think about all the people that are putting their life on the line for me and people like myself, they need to be taken care of too. We call them home care heroes, but without them, I would be in an institution and I would not be the man that I am today. I would be locked away, unhappy, and home care gives me the opportunity to live in a society where I can go out and do things. I'm not confined to an institution. That's why I stand behind the job plan, because if we get the training, if they get the proper wages, it not only takes care of them, but it takes care of everybody around them. If they got paid $15 an hour, $15 an hour may not seem, that's only a $3 difference, but that $3 difference could change my life where I could possibly get in a handicapped apartment and take better care of myself. So I'm speaking on behalf of everybody else that can't speak themselves. It's time for us to take care of them because they take care of us. I thank you for the time. Thank you. Sorry for getting tongue-tied. I'm a little bit camera shy. And thank you very much.
I loved everything you had to say, Brandon. Thank you for sharing that with all of us. Let me go to Charlene Lake. So Charlene Lake is a home care worker, a home care angel, to use Brandon's terminology, from Detroit, Michigan. She's been caring for people since she was 15 years old, when she began caring for her ill grandmother. It's been her life's work. Over the past 45 years, she has cared for people of all ages, from babies to seniors. She currently works with one private pay client for whom she provides hospice care. She loves being able to focus on one client at a time so that she can provide them the care and love that they deserve. Currently, her client's away in rehab, so she's not being paid while she waits for her to be released. It's hard for her when this happens, of course, because she needs the income and her work is truly her life, so everything goes on hold while a client is gone. In the past, Charlene worked for multiple clients who received home care through Medicare and Medicaid. She only made $8 to $9 an hour with no paid time off or other benefits. She struggled to pay her own rent and couldn't save any of her pay for retirement or a rainy day. She knows how hard it is to get by on poverty wages. So, Charlene, let me turn it over to you. Take the floor, please, and help educate us.
I'd like to say good evening and thank Senator Casey and also Representative Dingell for allowing me the space and time. And just to piggyback off of Lynn and also Brandon of what they was actually saying, yes, I have did it for 15 years. Since I was 15 years old when I worked for my grandmother. During that time, it was back then like $7 to $8 an hour, and it's only like 4 hours a day. So it was very difficult at that time, having a family, children. I did have a husband, thank God, for that. But even in that, having a husband, we went through rough times where I wasn't working, waiting for a patient that I could work for, and our lights and also gas was turned off. And we had to struggle during that time. It was like a month's time before we was able to get, funds to get our lights and also gas turned back on. And I do also want to say that it has to be a passion too for us, far as with caregivers, to work for these patients, because it's so many that's out there. They just working for a paycheck because it's like they feel that it's too hard for them to actually work the job for us taking care of the patients that they do have. And I feel that if it was a little bit more incentive, I think that it would be a little better, for us to work with. I worked on the low end, far as the $7 an hour, $8 an hour. I'm on the high end now, far as private duty, and like it was stated that I'm off of work, but being off work, I still don't get paid, anything, for that until she comes back home. So my thing is that I feel and I hope that, it does pass, far as we, get higher wages, because it will help us to help also the patients and, love doing our job.
Thank you, Charlene. Appreciate that. All right, we're going to go to Senator Casey. Doesn't need too much introduction. Everybody's been a champion for Medicaid home and community-based services for a long time. Chairman of Special Committee on Aging, and importantly sits on the Senate committees on finance and health, education, labor, and pensions, where sometime in the very near future here, we're going to be debating and hopefully passing significant funding and resources for Medicaid and home-based services. And Senator Casey will be at the center all of that and that major conversation and taking President Biden's wonderful proposal and trying to get it across the goal line. So, Senator Casey, thank you for everything that you've been doing up to date, and tell us what's to come.
Well, Faiz, thanks so much for guiding our call tonight and for your leadership on these issues. And I want to thank Social Security Works as well. And I'll tell you, there's not much more I could say to follow what Lynn and Brandon and Charlene already told us, because they made the case for why it is so important that we finally, at long last, make the kind of investment in home and community-based services that is equal to our rhetoric about how much those of us who are elected officials claim to care about people with disabilities. We claim to care for seniors. We claim to care about workers. And we haven't made the investment that is worthy of those claims of support. So this is a good opportunity. As much as we've been through this dark night of the pandemic, it's also provided us an insight into the value of caregiving and the essential nature of caregiving. So many Americans now understand better how important it is that we have the best home and community-based services in the world, not second best or third best, the best. And we can't say we're doing that if we have a waiting list, which the last number I saw was almost 820,000 Americans on waiting lists, which demonstrates the value and the popularity of these services, but so many Americans can't access them. And at the same time, the angels that Brandon just talked about, these workers who have spent so much of their lives, not just years, but so much of their lives giving, as Charlene and Lynn and so many others have told us throughout Pennsylvania and across the country. And yet they've contributed so much to our nation and to our families. And on average, they're paid $12 an hour. That's not American. That's not who we are. That's a place that no one would want to go. We've got to make sure that we invest in a great American idea. And that's what home and community-based services are. It allows people the independence that they want. It allows them the choice to have the care and the services in the setting that they want, in a home or in the community. And I think it's consistent with our values, or at least the values we claim to have as Americans. It's also nice that after President Biden proposed this idea of $400 billion investment, that we can say without a doubt that it's entirely consistent with Build Back Better, and especially the word better in Build Back Better. That if we make this investment, and I think we will, I'll give you a little sense of it in a moment, it'll mean better lives for seniors and people with disabilities, better wages and working conditions for workers, these home care workers who have given us so much. And the third better is better jobs, and frankly, a hell of a lot more of them. We know this part of our workforce is going to grow. So why don't we invest in it? Why don't we make sure that those who are providing care to our loved ones have the pay and the benefits that's commensurate with the great work that they do? I think that's a great American idea that we should live up to. So we've got a long way to go. This is just the beginning, because as you know, in the Senate, with all these crazy rules we have, the reconciliation process is just starting. So we're going to have a big, bold, transformative reconciliation bill starting in the Budget Committee and Chairman Sanders. And a part of that effort in reconciliation will be to make that investment in home and community-based services. So we're just about to introduce a bill. The bill has a name that you might be aware of. It's Better Care and Better Jobs. So it's consistent with what I just said. But this bill will be the start of the debate, so that we can put in right on the floor of the Senate a bill that will be part of the larger effort to make the investments in our families that, frankly, corporations and super rich people have been getting for 40 years. We live in a country where the tax code's been rigged for 40 years. It's about time we use the tax code and other pathways to invest in our families. And the family of America is a family that takes care of and invests in seniors, people with disabilities, and the great workers who are those angels that Brandon talked about. And finally, let me say this, there are also at the same time a lot of family caregivers who have not been lifted up and helped in a manner that's consistent with those same values. We got to help them as well. So all of this is at stake. And as challenging as it is, this is a great opportunity to have a whole new day for so many Americans who should be the subject of our attention, and especially the subject of our investment. So we're just starting, but thank you for the help you're giving us to get this bill and this policy passed into law. Thanks so much.
Thank you, Senator Casey. Thanks for taking a few minutes to share your legislative efforts with us, and we will obviously be right there in the corner with you fighting for it to get it across the finish line. Thanks again. So we were expecting.
I had one more thing.
Please go.
I forgot to thank my partner in the House, United States Representative Debbie Dingell, who has been on this path for a long time, working in the House to get support for this policy. And I want to commend and salute her work. And I'm sorry I didn't say that at the outset.
Very good. And speaking of Congresswoman Dingell, we were expecting her. Unfortunately, she's been caught up in some votes in the House. So I don't think we're going to have a chance to hear from her in the next few minutes. So we have gotten some questions that have come in. And so Lynn, Brandon, Charlene, if you're able to, I would love to point some questions at you and direct them your way. Maybe, Lynn, I wonder, first, obviously President Biden has introduced this $400 billion proposal in community and home-based services. I wonder, for many people are wondering, why should we spend that much money on Medicaid and home and community-based services? What do you say in response?
So I think it's funny because I don't think people really realize that paid caregivers right now are actually earning 20% less than comparable non-care jobs. Like I could go down the street to the Taco Bell and make more money than I do actually keeping people safe and alive. What that means for the economy is it means, first of all, it's high turnover. It means lower consumer spending. It reduces economic security. It means that families of people who need care actually end up working less. They have 13.9% more likely to have to stop work and leave work altogether. And all of this is a loss of productivity, and it's costing the economy. It doesn't make sense not to invest when you're losing $25 billion a year to lost income because we have people that have to leave work to take care of caregivers because they don't refuse to invest in the home care system. We have a system that can support what it has right now, but there's incoming people. We have so many people who are going to be starting to need care. The pandemic has highlighted that we can't take an influx right now. We actually have trouble finding workers. I know people who have been waiting 3 years for a shower. I know people who sleep 3 hours a night because they are family caregivers and they can't find anybody to cover a shift. I read a quote today from, I think it was Moira Donegan, and she said, care work makes the economy possible and its absence makes the economy impossible. And what is it if not infrastructure? So that's where I'm going to leave that one. We are infrastructure.
Brandon, you said something in your remarks that I wanted to go back to, and mentioned that some people don't want to make the choice to live in an institution. They'd like to have the opportunity to stay at home with their caregivers, with their community, in which they feel more comfortable. And obviously, Medicaid right now delivers some funding, and it kind of incentivizes institutional care. And what we're trying to do is obviously increase funding so that people can make a decision to live outside institution live in their homes. If you could say a word about that.
Yeah, I'm 32 years old. I don't want to be in an institution. I'm there's I'm physically disabled. I just want to be treated like everybody else. And these home care workers, if they get hurt, they have no. A lot of them have to worry about how they're gonna what they're gonna do if they get sick, or if like I have medical care, but a lot of home care workers they don't have medical care. They have to worry about how they're gonna pay their bills or get to work. So this to me is it's I'm glad that people are finally recognizing home care workers and people like myself, because this has needed to happen a long time ago. And if and when this does get passed, it would change my life for lack of better word. It would not only change my life, but it would change her life as well. Because then she wouldn't have to worry about what she's gonna do or how she's gonna pay her bills, or what if one of her clients goes to the hospital and has to stay in the hospital for two or 3 days at that time she's not getting paid. So it's I am so happy that they are finally getting recognized for who they are and what they have done.
Thank you, Brandon. And Charlotte, go ahead, please go ahead, Lynn.
No, I was just gonna ask if I could add one more thing to what Brandon was saying. So when Brandon was born, he was born in 1989. The Americans with Disabilities Act had not yet been passed. So he was born without, the rights that a lot of people take for granted today. The disabled community is really still being overlooked 30 years later. We need to do better. We really do. People do not want to be institutionalized. If you look at some of these institutions that were running in the 80s, they were terrible. They looked like concentration camps. Okay. We took people out of those settings and now we're incentivizing to put people right back into them. And it makes no sense. And it's inhumane. There's a budget. Show me where your budget, I'll show you your values. That's all I wanted to say. Thank you.
Perfect. Charlotte, I wanted to turn to you on how we actually demonstrate, or like currently we don't demonstrate respect for home care workers and the incredible work they do. And home care workers are not making decisions based on financials, right? Otherwise, you'd probably be, as Lynn mentioned, probably going off and doing other jobs. You're doing it because you care, because of the important, what it means for you and what it means for the community around you. And yet the community, at least our elite lawmakers, don't see this type of work in the same way they would as an investment banker or somebody else in a different part of society who happens to quote unquote generate wealth. And I wonder if you say a word about, like, in your career, how you think we can turn the tide of truly showing respect for home care workers and what that entails. What would respect look like?
I'm sorry, my computer froze. Can you repeat that question?
Yeah, sure. In short, Charlotte, I was just wondering what it would look like if we actually demonstrated truly showing respect for home care workers. What would it mean to you to if you looked around your society and said, hey, there's a society that actually respects home care workers? What would that look like?
Well, for me, it would look like just how I treat my patients, and that is with respect. And I was hearing Brandon speaking about going into the institution. I have worked in assisted living homes, nursing homes, everything I have worked in, and they have been the patients there. The respect that they get, they don't get it. The people would yell at them, scream at them, beat them, curse at them. the respect level would be that, you know, treat them with honor. How when I go on my job, this is what I do for my patients. And with the patients that I work for, any of them would tell you they would want me to work, you know, for them again, because I give them utmost respect. So if I get back what I give to my patients, that is the respect that I would want.
Thank you. Really appreciate that. And with that, it's been a wonderful conversation. Thank you to Lynn. Thank you, Charlotte. Thank you, Brandon, for sharing your stories. Obviously, thank you to Senator Casey for coming on. Unfortunately, we couldn't hear from Congresswoman Dingell, but I'm confident that she will not rest until this thing gets across the finish line. Social Security Works, I should say, has been a tremendous leader in this effort, both working inside on the Hill, pushing for this, but also making the case out there in the world about how popular this program would be. If we were to get this across the finish line, it would be not only the right thing to do, the morally right thing to do. It's incredibly popular. People support this, and we're increasingly going to need to rely on it as we have an aging population. So with that, thank you everyone for joining this conversation. Please stay tuned. We'll be tracking the developments in this fight over home and community-based services and making sure that a $400 billion proposal gets through. It would mean a lot to so many millions of Americans out there, including 800,000 plus people who are sitting on waiting lists and want this care. So let's all stay engaged in this fight. Contact your members of the House and the Senate and urge them to be supportive of this, because in the weeks to come, we're going to have this fight. You mentioned, I think Senator Casey mentioned that, you know, Bernie Sanders, the chairman of the Budget Committee, is going to be passing a budget resolution, hopefully with the support of all the Democratic senators, 50 senators, getting across the finish line, and it will have as a marker $400 billion for home and community-based services. So we got to fight to protect it, make sure it gets across the finish line, and stay engaged in this fight. So thank you all for joining us, and please stay engaged. Thanks a lot.